Ladies and gentlemen, it's always a pleasure to introduce and welcome speakers who have done so much for us without us even knowing it. I'm sure growing up, most of you would have. How many of you liked getting vaccines, injections? Anybody? Nobody? Really? Okay, there's two people there. Thank you. What most of you probably don't know is our next speaker probably had a little bit to do with some of them. She'd probably be able to tell you best. Uh, they call her the vaccine godmother of India. I don't know if she quite likes that, but that's what it says online. Dr. Gagandeep Kang is a professor of microbiology with the Christian Medical College in Vellore. She's currently on sabbatical, and she's been doing a lot of research with some of the world's top medical institutes in the area of drug delivery, vaccines, how diseases spread, community medicine, all of these things which the Christian Medical College is world famous for. And I personally consider it one of the best medical colleges in the world. And we should be proud that it's only about 150 kilometers away from here. Before I call her on stage, I'm very, very proud to tell you all that in 2019, she is the first and only woman to be invited to be a part of the Royal Society of Fellows. And without further ado, a big round of applause for Dr. Gagandeep Kang.
Hello, and thank you for the welcome. Good afternoon. I have about 15 minutes to talk to you about why we need to change education. That's easy, right? So, when I was a young-ish mother, maybe 15 odd years ago, my son was in 3rd grade and came back with a biology textbook that described a ball and socket joint, a hinge joint. Now, when I did anatomy, that's where we learnt these terms. Your elbow is a hinge joint. Your shoulder is a ball and socket joint. He was learning this in biology, and I couldn't understand why. When he went to 8th grade, he was learning about vaccines, and the focus on vaccines was what were all the diseases that vaccines prevented. But it wasn't about the principle of vaccination. It was about what is a bacterial disease? What is a viral disease? Is the vaccine a killed vaccine? Is it a live, attenuated vaccine? And I couldn't understand why he needed to know all of that. I gave up, as you frequently do with the Indian education system, and said, well, you've just got to learn these things because this is what you need to reproduce when you have your examinations. But then I thought about what happened when I went to Vellore. I went to Vellore as a medical student in 1981, and if I had slides, that would be helpful. And as a medical student, in the first year, one of the things that they did was take you out into a village and expect you to live there for 3 weeks, gather information on who were the people in the village. So we went to a village called Nellur, which was outside of Vellore, and you had to learn what was dry land, you had to learn what was wet land. You learnt about why there is a main village and a Harijan colony, that the water supply of these two areas is very different. And it taught you about how health is not your patient. Health is what happens in the community, and disease is what brings the patient to a healthcare facility, to a doctor. Now, if you look at health really, the biggest lesson we have in health is what we are relearning today after 2,400 years. If you look at the quote here from Hippocrates, what does he talk about? He talks about the environment, about the sun, the wind, the water, how people interact with each other. He even goes on to people who are fond of drinking to excess, people who are given to indolence, people who are fond of exercising and labor. So if you take all of the factors that were discussed 2,400 years ago, and if you look in India at what stratification and inequity mean to societies and to health, that gives us a framework within which we can operate. So I don't know how to move these slides, Daniel. Where do I need to point this to? I did. Yeah. Okay. So maybe I'll just work with next slide, please. So where I work is 150 kilometers from here, and what I'd like you to focus on is that picture of two children, right? They look healthy. When we studied malnutrition in medical college, malnutrition was either really, really skinny kids with their ribs showing, crying all the time, sparse hair on their heads. That was marasmus. The other form was children who had edematous feet, orange hair, swollen bellies, the picture of starvation that was known as kwashiorkor and was common in Africa and in India. That was acute malnutrition. We don't see that anymore. But what we don't see is the chronic malnutrition that these children represent. If you look at the child whose head is touching the green line, he is 2 years old and he is normal. If you look at the child who is under the red line, he looks healthy, but he's 4.2 years old and he is only 97 centimeters when he should be 104. This is chronic malnutrition, and this is what we were talking about today, what determines human capital. A 1 centimeter difference in height for men makes a 4% difference in your income as an adult. For women, that figure is 6%. This is not a deprivation that we currently see today. Could I have the next slide, please? Now, if you look at the other end of the spectrum, what we are seeing today is obesity. The Comprehensive National Nutrition Report came out last year, and what we see there is that now we have 1 in 10 children in the country are pre-diabetic. If you look at children who enter school, 5-year-olds, 1.5% of them are diabetic. School leavers, 0.5%. Now, if you are an epidemiologist, this shows you how rapidly society is changing. There is an increase of 3 times in 10 years of the level of diabetes in our populations. Now, if we look at what our education system tells us a good student is, a good student is one who comes first in class. A good student is not the well-rounded student who plays basketball, football, cricket, acts, sings, dances, and does reasonably in class. This is a picture that we really need to change, and particularly if you look here in Tamil Nadu, 14% obesity in adolescents is unacceptable. The next slide, please. Now, if you look at what we study in colleges, in schools, what we study is physical development, growth. You think about disease, how diseases spread. What you don't think about is what you don't see, and this is mental health. If you look at where mental health issues arise, suicide is only one example of how we don't look at mental health. And suicide in adolescents in India is very different from suicide in adolescents in other parts of the world. Why do we have this? Because we have what is known in our rural communities as school failure or love failure, something to which we have made it acceptable for students to think about this actually being an option for them. And there are interventions. There are simple interventions that can be brought into school. The WHO recommends what is called the QPR method, a simple 3R training program that says question, persuade, and refer, that can change the face of how mental health is looked at in schools and in our communities. Next slide, please. If you look at pandemics and epidemics, you know when we respond to infectious diseases? After they start. Suddenly, there will be screening at airports. There will be people walking around with masks. But when does the preparation actually need to be done? It needs to be done so that people understand how diseases spread before they happen. We've had the examples of Ebola, Nipah, SARS, MERS, H1N1, which thankfully was not a killer disease. In the last 20 years alone, have we changed any of our thinking or our education at all? Absolutely not. Where are these diseases coming from? We know Nipah came from bats. What do we do to teach children about how they should associate with either pet animals or animals that they encounter in the wild? This level of preparedness is something that is important not just in schools, but in all of society. The next slide, please. What about prevention and screening? We invest a lot we heard about vaccines, and more recently, there has been a rise in what is called vaccine hesitancy. The problem is if people don't see a disease, they don't see the need to prevent the occurrence of that disease. They don't see the need to take a vaccine for that disease. So we have increasing cases of diphtheria in UP and in Kerala. We see pockets of measles. We've never been able to control measles in our country. And increasingly, in middle-class urban populations, the levels of immunization are going down. We don't accept prevention as a way of promotion of health. So these are things that need and must be taught in schools. When we look at screening, the idea of any people in this room who are above 50? How many of you have had a colonoscopy? Oh, well, didn't see a single hand. And you should. One, right? So if you think about prevention, these are simple tools that nobody is using because prevention isn't something that is taught to us. And with new technologies becoming available, prevention is going to become easier and easier. If you look at the map up there, you can see in the orange and red, that's where vaccine-preventable diseases are, and that's also where vaccination rates are the lowest in the world. The next slide, please. So what about financial protections? Do we ever plan for that? In India, 2/3 of the spending on healthcare comes from out-of-pocket expenses. Do we teach children about health insurance? Do we talk to policymakers about what it means to be able to plan for health expenditures, both for prevention and for treatment? Our health budget within the government is one of the lowest in the world, and we keep hearing about how difficult it is to increase spending. We have new initiatives now. Some of them started out, with a big announcement, and now we are discovering the problems with making those exercises functional. The next slide, please. So to end, I think what we need to do when we think about public health education is really think about starting with the end in mind. We need to integrate health as a part of life, think about screening and prevention and the promotion of health. We need to think about mental health education, something that has been completely ignored. Physical education, at least we are beginning to hear about now, as we are about nutrition, but the rising levels of obesity tell us that that message is not necessarily going home. Now, in terms of financial protections, now this is something that is largely ignored. We don't teach people out of school how to be ready for life, how to manage, how they are going to function in society. And we don't teach people to weigh the evidence. And this is particularly important in an era of social media. How many of you have taken an antibiotic for a fever? What proportion of fevers require antibiotics? A few. If you have typhoid, you'd better get an antibiotic. But for most of the fevers that you encounter, the dengues, the chikungunyas, the influenzas, those are viral. Antibiotics make no difference and contribute to antibiotic resistance. How many of you have had a chickenpox vaccine? I can see about 30 people in the room. And this is a middle-class, educated population. This is an extremely important vaccine for young people to have, and yet because it isn't in our public health program, we don't use that at all. So I think what we need to do to change education is to think about what is fit for purpose. What is the approach that we need to take at every stage and every age, whether that is in primary school, in high school, or in college education. Emphasizing health makes us fit for life, for work, and for citizenship. Thank you.